What does that look, what is a self-reported quality of life from asylum seekers, particularly those who are already seeking treatment? And talking about this very important subject will be Dr. Neha Sikka. She is the chief resident at the Mount Sinai Elmhurst Emergency Medicine Residency. Not an easy job at all. She's been involved working with survivors for over 10 years. She's done a good deal of global health work, including efforts at polio eradication, the Centers for Disease Control and Prevention, and I would very much like to welcome Dr. Sikka to the microphone.
Hi, everyone. Thank you so much for inviting me to speak. As an update, thankfully, they let me graduate residency last year, so I am now actually an attending physician at Bellevue and a clinical leadership fellow, so kind of an administrative fellow within New York City Health and Hospitals. So my name is Neha Sikka, and today we're going to talk about quality of life in torture survivors that utilize a comprehensive torture treatment program. Of note, there are a lot of logos on the top of the slide, so we'll talk through those a little bit, but I just want to point out my co-authors listed on the slide. Many of them are here, and they're really key to what I'm about to present on. So this is kind of what we'll talk about overall in our slides. And this was the conference learning objectives. I just want to say that we'll mostly be kind of working towards objective number 2. At the end of this presentation, I'm hoping that everyone here will understand some of the tools that can be used to measure quality of life in torture survivors and understand how participating in a comprehensive torture treatment program can affect quality of life. So, like I said, I would explain the logo. So we just heard an amazing presentation from the Mount Sinai Human Rights Program, which is part of the Icahn School of Medicine at Mount Sinai. I am here on behalf of Libertas Center for Human Rights, where I volunteer, and Libertas is located within New York City Health and Hospitals Elmhurst, but there's a unique partnership that exists between Elmhurst and the Icahn School of Medicine at Mount Sinai, so we're lucky to have the support of both organizations in our work. If you aren't familiar with New York City Health and Hospitals, it's the largest municipal public health system in the world. It is the public hospital system of New York City. This is the pyramid of values, and what's really key for our public health system is that it's committed to caring for all patients without exception. Elmhurst is kind of a little extra special portion of this. It's the largest public hospital in Queens. It's a level 1 trauma center, and this picture actually is what the trauma entrance looks like. And what's really interesting about it is it's located in the most diverse zip code in the world. So we really are lucky at this hospital to have patients that come from all over that speak incredibly different languages and have different lived experiences. It's also one of the busiest emergency departments in the US. I think this statistic is actually a little old. I'm pretty sure the statistic for this past year has been over 140,000 ED visits. And what's notable about this is, thanks to some of the people in this room, a study was done in 2009 that surveyed our patients in our emergency department and found that over 6% had had some history of surviving torture. So when you see over 140,000 patients a year, this means thousands of patients who come through our emergency department are likely survivors of torture. And then just to zoom in a little bit more on the Libertas Center for Human Rights, it was founded in 2006 by emergency medicine physicians at Elmhurst, and its mission is to provide integrated services to help survivors of torture in the New York area heal, regain independence, and restore hope and humanity in their lives. And it has a very similar vision that all survivors of torture in New York City lead healthy, confident, and helpful lives. There are lots of different services offered by Libertas, and so to go through each of these, primarily medical. Libertas offers expedited access and dedicated appointments for both primary care and OBGYN visits, and then for clients who need other types of services, can coordinate expedited appointments. As far as mental health, there are different types of therapy offered on site at Libertas, including individual and group therapy. And again, there's expedited access, included dedicated appointments to give behavioral health clinic appointments to our clients. We have pretty extensive social services with case management that coordinate both internally with health and hospitals and also externally with the community partners, and really helpful access to whatever services the clients need, whether that's housing, food, clothing, education, the list kind of goes on. And lastly, there are legal services. We don't have a lawyer on our staff, but work closely with NILAG, which is the New York Legal Assistance Group, thank you, to do legal case management, including helping with medical records or paperwork that's needed. We partner with lawyers on guidance for legal questions, and we do medical and psychiatric forensic evaluations. So our question for the purpose of this study was a pretty simple one. It was, does participating in a torture treatment program, like Libertas, improve quality of life for our clients? And we very proudly hypothesized that yes, and so let's look into it. So to start, we utilized two different quality of life scoring tools, one by the World Health Organization and one by the NIH. The World Health Organization created something called the WHO Call BREF, which is a little bit of a mouthful, but it's the World Health Organization Quality of Life Brief Survey. So initially, the World Health Organization created this 100-question survey that they actually created internationally. So they co-developed this questionnaire around the world, and then they realized that 100 questions was a lot, so they shortened it to a 26-question survey, hence the BREF portion. All the questions are Likert scale. And like I mentioned, it was developed around the world at 15 international centers. So they actually used centers and co-developed it in the native language of each of the countries that they developed in, which allowed it to be validated for global populations. And what the survey does is evaluate self-rated quality of health and also domains of physical, psychological, social, and environmental health. And here you can see some examples of kind of the overview questions in the survey. And then the other survey that we utilized was from the NIH, and it's the PROMISE survey, or the Patient Reported Outcomes and Measurement Information System survey. This is actually a very, very long questionnaire. The NIH underwent kind of a task to look at all the questionnaires that patients were being asked and try to kind of focus them down. So they created a list of different questions to look at aspects of physical, mental, and social health, and created them all again on a Likert scale, so a scale of 1 to 5. Then they validated them on a US-based population rather than an international one, but a very diverse one. And so here you can see one example of the questionnaire, which is emotional support. And what's helpful about the PROMISE questionnaire is you can pull out these different sections to ask specifically areas that you were interested in. So the methods of our study are pretty straightforward. As a client reached out to Libertas, we would do an intake survey that included asking about demographic data, and then starting in 2017 also included the WHO Call BREF questions and the emotional support and informational support questions from the PROMISE survey. So emotional support is questions like, do I have someone to turn to if I need someone? And then informational support is, do I have someone I can ask advice to? The clients then went on to utilize Libertas services, whichever services they needed among the medical, legal, mental health, or social services that we offer. And about a year after, they would receive a follow-up survey that asked the same questions from the WHO Call BREF and PROMISE. This is kind of a bullet point slide of what I just went through, but to highlight, we did collect demographic data on the surveys as well, including age, sex, ethnicity, and religion. And I would just want to point out that questionnaires were kind of administered in a mix of different ways. Some were in person, some were telephonically, and some were filled by the clients themselves. And this had to do with the language of the participant, their literacy level, and because this was between the years 2017 and 2023, COVID-19 precautions. And then this is kind of the boring slide about statistics, but all of our statistics were done in Excel or R, and we did a mix of basic statistics and comparisons using ANOVA. So this is a little bit about our survey analysis selection. So again, we focused on the years of 2017 to 2023. And this time we found that 250 clients had complete intake surveys, but we focused on the 57 that also had complete follow-up surveys. I just want to acknowledge that over 100 clients had other complete surveys, but either their intake happened before 2017 or they were kind of towards the end of our study period, so we hadn't had a complete follow-up yet. So those were not included for the purpose of this study, which was really meant to be a comparison between intake and follow-up. Using our 57 participants, we found the follow-ups were just about 13 months, a little over that year mark after that intake. And so just to go through some of the demographic data that we collected about our 57 participants, on the left here, you can see a pie graph about the sex breakup. So about 54% were male and 46% were female. And then on the bar graph on the right is our age distribution, where you can see a majority of our clients were between the age of 21 and 50. The bar graph on the left here shows their reason for persecution, and a majority cited social group or political reasons. And then among our clients who had ability to be employed, about 33% were unemployed. Just a quick shout out to the conference organizers who included a map slide in their slide deck, which inspired me to make this. But this is kind of a map of where the 57 clients are from, and to kind of talk about the themes that we've been talking about throughout today. There really are a global representation. Just under half are from Central and South America, about a quarter from Asia, and then about 10% from Europe, especially kind of East Europe, Russia, and Africa. And you can imagine with clients from all over the world, there are also many languages that were spoken among our clients, the largest of which were Bengali, Spanish, and English, but as you can see on the word cloud here, many other languages were also included. So to talk a little bit more about our survey results, I'm going to start by just highlighting those overall questions on the Who Called Breath, because I think they're really good summary questions. So the first question is, how would you rate your quality of life? And again, this is a Likert scale, so everyone selected a number between 1 and 5 when they ranked their own score. And so our intake average was just about half, 2.54. At that follow-up, our average was 3.12, which is a 24% improvement. The second overall question that's offered by the Who Called Breath is, how satisfied are you with your health? Again, our intake was just about halfway on that 5-point scale at 2.47. Our follow-up was 3.15, which is a 28% improvement. So we're happy to see improvement in both of these. This was echoed in the other domains that our surveys use. So as a little bit of background, the Who Called Breath has different numbers of questions for each of the domains it measures, but then uses a formula that's publicly available to put those on a 16-point scale. So that's what's mapped out here. And so we see for the first domain, physical health, there was a 13.4% improvement. In the domain of psychological health, a 25% improvement. Our social relations domain showed an almost 10% improvement. And then our environmental health domain showed an 11.1% improvement. And all of these were statistically significant, except for social relations, though that still showed an improvement. And then our promise scores are on a 20-point scale. And we saw for emotional support a 22.2% improvement, and for informational support a 16.7% improvement. So truly across every domain that we had been measuring, we saw improvements after utilizing our services for about a year. After this, we looked back on our demographic data to look were there any inequities in the improvements that we were seeing? And we did find a couple significant differences based on sex. So among our initial self-reported scores, the one difference that we saw that was significant was just in self-rated physical health scores, where men initially rated a higher score than women. But then when we looked at improvements, we actually found that there were a couple of areas where men had smaller improvements than women. So the first was physical health. And again, we know that men at baseline rated their health as higher. So the improvement of 0.529 versus 2.61 is probably just kind of equalizing at the end at the follow-up of kind of how our men and women are self-rating their physical health scores. But we also saw smaller improvements in their social relations domain and their informational support domain. I know our panelists earlier touched briefly on how men and women sometimes are perceived as being open in different ways or processing their torture and their trauma in different ways, and that could be part of this. So some limitations. Like I mentioned earlier, we only included participants who had complete intake and complete follow-up surveys, so we do have other survey information that'll have to be analyzed at another time. Surveys were given in different methodologies, thanks to the pandemic, to literacy, to whatever language the client spoke. And although all of our clients utilized Libertas services, they didn't necessarily utilize the same services, since it's kind of as they needed. And these are our conclusions. So I hope that from this you can learn that Who Call, Breath, and Promise are surveys that you can use to measure quality of life among the clientele that you serve. We're happy to report that everyone who utilized our services seemed to show a general trend of improvement in all of their domains. But again, we did see those difference in improvements between men and women, so that might show that there's some more targeted work to be done. That concludes the talk. I just want to give a special thanks to the staff of Libertas, all the clients that we serve, both Elmhurst and Sinai, for supporting us, and all of our funders, especially in these trying times. And here I have the Libertas staff. Many of them are in our room right now, and they truly make this work happen. Happy to take any questions.
Thank you for a great presentation. Those of us who, all of us do pre-post measures, and I noticed that, there is a drop usually between how many people do an initial and those who are able to do the post. What do you feel are some of the more common factors for not being able to do the post?
Yeah, I think there's a few. As you kind of alluded to, everyone has competing priorities on their time, and even though these are shortened questionnaires on top of the demographic data that we collect and other information, that does lead to a lot of time. And you can imagine, especially when you're using an interpreter, that is quite a lift. I also think people can utilize our services as needed, so sometimes not everyone will have a full follow-up if they don't fully utilize and need one. And then the other limitation, like I mentioned, is this was really from 2017 to 2023. And because of those time gaps and COVID in the middle, that also led to some difficulties getting both a complete intake and a complete follow-up. Okay, great. Thank you, everyone.